Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Cavan-Smith. Although sub-Saharan Africa has reported fewer cases of coronavirus than many other regions, numbers are creeping up. Most patients are in South Africa, with at least 13 confirmed. Also, there are ongoing calls for justice for the dozens of South African women who suffered forced sterilisation. We hear from one woman who discovered that her uterus had been removed without her consent 10 years after it happened. And farmers in southern Angola are finding it increasingly tough to work the land. With changes in the weather and men often working away, women in rural households often bear the brunt of trying to make ends meet. But first, the World Health Organization said that the coronavirus outbreak is now a pandemic. Sub-Saharan Africa has so far seen far fewer cases than most other regions outside of the continent. Numbers are rising, though. But on Wednesday evening, reported sub-Saharan cases were still under 24. Most are in South Africa, which recorded 6 new cases Wednesday, bringing the total to 13. All had recently been travelling in Europe. Aisha Ishmael joins us now with more from Cape Town. Aisha, so tell us a bit more about those cases that have been confirmed so far.
Well, Georgia, the first coronavirus case was confirmed on March the 3rd, and a week later, the number now stands at 13. And as you pointed out, of these 13 people that have been diagnosed with the coronavirus, they've all traveled abroad to countries in Europe, including Italy, Germany, and Portugal. And the 13 cases are spread across 3 provinces for the time being, and that is KwaZulu-Natal, Gauteng, and 1 confirmed case in the Western Cape. Now, about 645 tests have been conducted in South Africa so far, and there are designated hospitals to deal with those showing symptoms of the virus. And they are tested, and if the diagnosis is positive, they are then treated at those designated hospitals.
So what effect is all of this having on people's lives?
Well, if one only looks at social media, for instance, just about everybody is talking about the coronavirus. People are also talking about it at dinner parties. People are talking about it at family gatherings. And of course, some supermarkets have already run out of hand sanitizers. They've run out of disinfectants as well as hand paper towels. So there's a lot of awareness about the coronavirus in South Africa. And of course, the government is updating people on a regular basis on a national level as well as on a provincial level. There is information coming out, and there's also regular press conferences being called by the government of South Africa to inform people about new cases and about, how widespread the coronavirus is.
So beyond the effect it's having on people's day-to-day lives, has there been so far any effect on South Africa's economy?
It has indeed, and as you know, South Africa is in a recession at the moment. It's got an ailing economy, and the coronavirus is definitely having a negative effect. And we've also heard about, especially in the seafood industry, where people are not able to export to China anymore because the demand for seafood, and especially rock lobster, there isn't a demand for that anymore. So that the seafood industry is suffering tremendously, and of course the fruit industry as well. But it's not only the exports that are being affected; it's also the imports, because the retail industry, people that are trying to get imported goods from China, are not able to get those goods out of China anymore.
So one thing that has been got out of China, or at least is in the process of being removed from China, are those 120 South Africans who have been stuck in the Chinese city at the heart of what we now know as a pandemic. 120 South Africans being brought back from Wuhan. A plane was sent out to bring them back. Is there much risk of doing that?
That's correct, Georgia. A chartered plane was sent out last night to Wuhan and to go and collect those 120 South Africans who wanted to return to South Africa. And there were 15 officials on board from the Department of Health, as well as the South African National Defence Force military health staff. And what will now happen is that 120 people are expected to arrive in Johannesburg on Friday, and the protocols put in place for COVID-19 will then kick in, and that is the screening at the airport that will take place, as well as the initial quarantine time of 21 days.
Thanks very much. Aisha Ishmael there for us in Cape Town. Well, on Wednesday, Ivory Coast confirmed its first case of COVID-19, which was reportedly a 45-year-old man who'd recently been to Italy. Meanwhile, Egypt's total number of cases has risen by 7 to 67. Dozens were from a Nile cruise ship in Luxor. A group of 46 French and US tourists who'd been quarantined on board since Saturday have flown home after testing negative. Egypt's gone to great lengths to try and reassure travellers that it is still safe to visit, and it has massively expanded efforts to test for the virus and limit the risk of infection.
Due to our precautionary measures, we've managed to detect the virus in 45 people on a Nile cruise. All of them had no symptoms. As of Tuesday, 25 of them tested negative for the virus. We've decided to expand our investigation and have tested all the boats and hotels which surrounded that infected cruise ship. We've taken 585 samples in Luxor, and all of them are 100% free from the virus.
Now, there's still outrage in South Africa over the dozens of women found to have been tricked or coerced into sterilisation at healthcare centres across the country. 48 cases of women, many of whom were HIV positive, others who, for one reason or the other, were judged by medics to be unworthy of having kids, told the Commission for Gender Equality that they'd had the ability to have children taken from them without their consent. Bongekile Msibi found out a decade later that doctors had removed her uterus when she'd gone into hospital to have her first child.
Many South Africans were shocked when a recent report said dozens of women were sterilised without their consent. Doctors removed their uterus without them knowing. Most of the documented 48 cases concerned black women who were HIV positive. Bongekile Msibi is not HIV positive, but she was one of the victims. She was trying to have a second child when her doctor told her she didn't have a uterus. She went back to the hospital where she gave birth a few years ago. They simply told her they removed her uterus after the child was born, but didn't say why.
Unfortunately, I can't just sit back and be okay with the fact that I don't have a uterus. I don't even know why I don't have a uterus. You know, if maybe there was a valid explanation, maybe I could find closure and, accept. But it's so difficult to find closure when I don't even know why I don't have a uterus.
The Commission for Gender Equality carried out the investigation. The procedures were conducted in dozens of hospitals on women who gave birth via caesarean section between 2002 and 2015.
There was no reason for these women who were living with HIV, for these women who were found to be having TB, and for these women who chose to have 7 babies to actually be operated on in that manner.
The South African government said it would meet the victims of coerced sterilisation. Activists say it must, above all, swiftly investigate all the medical professionals involved in the scandal.
Well, farmers in southern Angola are finding it increasingly tough to work their land. With changes in the weather and men often working away, women in rural households often bear the brunt of trying to make ends meet under increasingly difficult circumstances. Take a look.
First there was the drought, and then came torrential rain and severe flooding. Southern Angola's farmland has been devastated. By now, Musaka Fernanda's crops should have been towering over her head, but the 47-year-old farmer has little to harvest. To her, climate change means hunger.
We've been waiting for rain for 6 months. 6 months without rain, and before that we had winter. When the rains came, we were so thankful. We were relieved. But they came too hard, and then we had no way of tending to our crops. We were not able to go to the fields.
With the threat of famine looming, Musaka alone is responsible for feeding her 9 children. Like many men in the region, her husband moved to the city in search of work.
He left because of hunger. There was a time when he used to buy food for the children. They used to share the work. But when the hunger got bad, he decided to go.
And it's not just the mothers. Humanitarian group World Vision finds that their daughters also live the consequences of climate change.
Because of families being separated or abandoned, we find a lot of families with a single parent, so it's the girls that end up helping their mothers in one way or another. So they are likely to stop studying. They first need to provide for their basic needs.
Musaka's two eldest daughters dropped out of school to help out at home. But when her eldest fell pregnant, Musaka asked her to move out and live with the father.
My mother said, "You have to get married because you can't burden me with this. I'm already struggling enough with all of you. I cannot suffer more with you, your baby and your boyfriend."
It was a difficult decision, but Musaka had few alternatives. 45 million people face famine in southern Africa, according to the UN. And 8 of them are dependent on Musaka's daily efforts, as she continues to work the land alone and in the face of climate change.
Well, that's it for Eye on Africa. Thanks for joining us. Do so again. Take care.